Hi everyone, I'm Dr. Bornali Datta. I'm a pulmonologist and a public health specialist. Today our topic of conversation is diagnosis of tuberculosis. Tuberculosis is a disease that, if diagnosed well on time, is completely curable and the patient gets much better. However, if there is a delay in diagnosis or if there is a misdiagnosis, that leads on to a prolonged period of suffering for the patient, as well as the spread of the disease in the community for those who have pulmonary tuberculosis. Now, tuberculosis can be pulmonary or extrapulmonary. So pulmonary tuberculosis means within the lungs, and extrapulmonary means outside of the lungs, either in the lymph nodes or any other part of the body. Now, how do we go about diagnosing tuberculosis? For pulmonary tuberculosis, the very key initial screening test is a chest X-ray. Chest X-ray is by no means a confirmatory test, but it gives us an idea if the patient may have pulmonary tuberculosis. This has to be followed up with what is called a microbiological confirmation or diagnosis. This means testing of the sputum, which originally used to be done by microscopy, but now we have very good molecular diagnostic tests which within an hour or two can give us the confirmed diagnosis of tuberculosis. We also have culture for the bacteria, the mycobacteria rather, and the culture is also often considered the gold standard. Now, I must point out that molecular diagnostics have really taken over TB diagnosis. They not only confirm the diagnosis of tuberculosis, but also tell us whether the patient has drug-resistant tuberculosis. Earlier, it was for one drug, rifampicin, but now we have modules which also help us confirm whether there is resistance to other drugs as well. What other means can be used? If there is lymph node TB, for example, if someone has a gland in the neck, then we can do a FNAC with a small needle. But these are very essential. Gone are the days when we diagnose TB based on simply a chest X-ray or simply on a clinical hunch. We must confirm it microbiologically. That's very important, so that we know whether it is drug-sensitive TB or drug-resistant TB. Now, TB diagnosis is widely available at the present time. However, many patients still face problems with access because we are looking at giving them the best quality diagnostic tools that are available to us that will confirm the diagnosis for us at not very great cost. So affordability then becomes an issue as well. Many private labs do tend to overcharge, and I think it is very important that we ensure that the patient gets all the diagnostic tests for free, because the government centers offer chest X-ray, they will offer sputum microscopy, sputum culture and molecular diagnostic, all for free. So it is important to make the patients aware of this, that they seek healthcare advice at the earliest, at the nearest center, the primary healthcare center or whatever the government center is closest to them. Many private centers look after TB as well. They are linked to the government centers now, and the patient has to be encouraged to seek care for in any of these centers. Once they have gone to these centers, they will be directed to the nearest center which does diagnostics at the lowest cost that is affordable to them, but without compromising the quality. Now, we must remember that TB testing sometimes can take a lot of time. Now, earlier we used to do TB cultures, which sometimes take 6 weeks, 8 weeks, and the patient will definitely not follow up for this length of time. So it is imperative that we use the new molecular diagnostic tests that we have. We give the patient the diagnosis within an hour or two, and then the patient can follow up with their clinician for starting the treatment if they come positive. As healthcare workers, it is important for us to give guidance and counseling to the patients. So they will not be aware of the systems that are available to them, but we must ensure that the systems available are offered to them, the process is made smooth for them, and they get timely diagnosis, timely help. Remember, in life, as in medicine, it all begins with the right tests. So let us ensure that our patients get the best and the most affordable tests for us to defeat TB. Thank you.